Welcome to our second virtual session to get to meet and greet the residents at the University of Virginia and some of our faculty. As we talked about last week, we're going to break these sessions up into 3 separate sessions. Last week we talked about our operative experience in living in Charlottesville. And you know, hopefully we got some new guests and some old guests, some returning guests. But if you missed that session, then feel free to go to our website, and it's been recorded, and you can just watch it at your leisure. Today, we're going to focus on our research and professional development years and our educational philosophies and how we approach education, both as learners, but also as teachers. And we have 2 faculty guests today, Dr. Shana Showalter, who is our Deputy Vice Chair of Research, and Dr. Philip Smith, who is our Associate Program Director. So I'm just going to take a minute and let them both introduce themselves and explain who they are and what their roles are. So Dr. Showalter.
All right, and I'm unmuted.
You are.
Great. Yeah, so as Dr. Phil said, my name is Shana Showalter, and I am a breast surgeon here at UVA, but also in the role of Vice Chair of Research, so helping residents figure out their spots with mentorship and during the research year. So I will talk a little bit about that in just a second in terms of how we structure our research program here.
Hi, I'm Philip Smith. I'm the Associate Program Director. I'm also a former resident. I'm a graduate of the program as well, and I'm going to talk some about education.
So that's great. And I'm not entirely sure I said my name. So I am Charlie Farrell, and I am the Program Director here at the University of Virginia. And so we're going to share our screen and go on with the presentations, which we're going to keep short so we can get to the breakout rooms and you guys can discuss these important issues with our residents. So this is our program aim, and we talked about this briefly last week. You know, this is what we're trying to accomplish. If you come to the University of Virginia, we have 3 major goals. One is, first and foremost, to make you a clinically excellent surgeon, and we focused that on that, a lot of that last week. But we also are incredibly focused on other missions, which include our commitment to education, because we expect you to educate the next generation of doctors, and also to be quite involved in scholarly activity, because we are an academic program and our goal is to train academic surgeons. And so when it's all done, we want you to look like one of these 5 graduating chief residents from last year. They are incredibly accomplished with nearly 300 total publications, with just a multitude of awards for various efforts, including teaching and research awards, over 100 podium presentations nationally. And as we talked about, they're both all clinically excellent with just about 1,100 cases. So to keep the theme going there, I'm going to now defer to Dr. Showalter and allow her to really focus on how we're going to make you into academic surgeons and really focusing on our research mission. So Dr. Showalter, you're on.
Great, and let's see if it worked. I request, beautiful. Okay, so I'm going to talk briefly about the research years. So we are committed to providing 2 excellent research years to all of the categorical residents. That being said, there's oftentimes caveats to that of people that end up taking more time or less time, and we try to be as flexible as possible, but the baseline is that we are committed to providing those 2 years to all of the categorical residents. And with that being said, we really are looking for residents that are interested in research, and then we're here to provide those opportunities and then the training within the research. So doesn't mean we're looking only for people that are accomplished researchers, because not everybody has had those opportunities in their undergraduate and medical school experiences, but we're certainly looking for people that want to make that part of their residency and then potentially part of their future careers. Okay, so just briefly, and we don't need to go into the details of this, but what I'm going to show in the next couple of slides is the funding that's within our department. And I think that this is impressive coming from a somewhat smaller surgery department, but also just shows that the folks that do get to train here are coming into a department that is very well funded, and will continue to be so. And so there are just a lot of opportunities to work with successful researchers. So we currently have 10 R01s, and then you can see the list of the other NIH grants. The T32 grant that we have is a really unique and great opportunity, because that's a training grant that provides funding for several residents each year to be in surgical oncology research. So that is something that we're proud of as well. Let's see, this next slide just continues with that, but showing non-NIH funding. So foundation type of research that our attendings are funded, and then also departmental and UVA research. And then this slide is talking in 2019, members of the department submitted 86 grant applications. And I think the point of showing you this is just showing how busy we continue to be in submitting grants. And one of the nice things about the research opportunities at UVA is that although we don't expect people, the residents, to write and get research funding on their own, we definitely do teach that as part of it. So that's something that I did not have in my residency, and I wish I did, but residents in their research years can be as involved as they want to be in terms of writing grants and being involved in that process, which is great training to have for your future. So in terms of research opportunities, we have several, because of the funded faculty. We have basic science research, excuse me, outcomes research, clinical trials, and then also translational. So really covering all of the potential opportunities that anybody might want to do. And then because we're within UVA, within the larger university, we also have opportunities outside of our department in terms of collaborating with basic science people within the School of Medicine, and even within schools outside of the School of Medicine. We have had residents that have left UVA for their research years, and we are always trying to be as flexible as possible with those opportunities. We don't necessarily, you know, we always have to talk a little bit about the details with the funding, but we are flexible with that and have had research residents do some pretty unique and interesting things outside of actually staying in Charlottesville for that time. One of the things that impresses me, and again, something I wish I had done during this time, is a lot of the residents are now pursuing advanced degrees. So getting an MPH is something that has become very popular, and we've made it, because so many residents have done it, there's a pretty clear path and a lot of help from senior level residents in terms of how best to do that. And then I think we've had a total, and Dr. Friel, correct me if I'm wrong, 3 residents that have actually gotten PhDs during their research time. This is a picture of Eric Charles, who's one of our recent graduating chiefs when he was presenting his research for his PhD. The residents are impressively productive during the research years, with multiple publications, and multiple opportunities, hopefully again, to travel for national presentations. One of the things also I think that's not necessarily unique, but in a way unique to UVA, is just how many resources there are within the School of Medicine, within our department, to help make research as easy as possible. So we just have a lot of great collaborations within other departments within the university. There's people here to help with grant writing, with grant submissions. There are people at UVA to help with protocol development, and there's a ton of biostatistics support. So all of these things exist, and it's really nice to be able to have that resource, so you don't have to seek those things out. Our department also has a group that we call STAC, which is basically our group of research coordinators. Again, just something really nice and a really good resource of very excellent and well-trained research coordinators. And then in terms of the support during the research years, this is again something that I've just been continuously impressed with. And of course we have faculty mentorship, because that's kind of basic to any residency program that's going to provide a good research experience. But one of the things that's been impressive as I've been working with residents is how much resident mentorship the residents provide for each other. So even between the resident that's in their second year, helping residents that are in their first year of research, and even as the residents are coming in, it's just amazing to me how much they've been able to help get junior residents, and how willing the senior residents are in terms of authorship and that kind of thing, and helping their fellow colleagues get the ball rolling and get projects going and through the system. It's just something that I'm continuously impressed with. And then we also have a monthly conference for all the research residents that we split it's an hour over lunch when we can be together, but usually split, where one of the residents gets the opportunity to present their research. And then the other half is a faculty member providing some sort of mentorship type of lecture, life skills, how to get a job, how to apply for a grant, how to negotiate, all of those kinds of things. So that's something that all of the research residents attend once a month, and is pretty well attended also by faculty that are interested in research. So I think that is all I have together in terms of a formal presentation. At this point, I am more than happy, and please feel free to speak up and not to be shy, to answer any research related questions. We are going to have a breakout session where you guys can chat with the residents without attendings around. But before I give it over to Dr. Smith, please feel free to ask me any specific questions to our research program, about our research program.
And if you do want to ask a question, I think there's a little button you can raise your hand, and I think that Kristen will be looking for raised hands if there's some questions out there. Kristen, I'm counting on you for looking for hands. So I do want to stress what Dr. Showalter was saying. I mean, we are an academic program, and we're looking for residents that are interested in pursuing these opportunities. But it does not mean that you have to come in with an academic background. What we need is people with passion, with energy, with commitment, and who want to work with people like Dr. Showalter, quite frankly, because she can make you into that person. So don't be intimidated if that's not in your background. Eric Charles, for example, who got his PhD, had almost no research background and was one of our most successful research residents. So all we need is a passion and a desire, and we have the resources and the mentorship to help you get to where you want to be. Is that a fair statement, Dr. Showalter?
Oh, for sure. Yep. I think, and I mean, I know that just from sitting in the discussions we have when we're talking about our applicants, that it's mostly just the drive and the willingness to learn more so than people that have come in with a significant research background, which helps as well, but not necessary by any means.
So I'm going to turn it over to Dr. Smith and get that screen back up, and here we go.
And while you're doing so, I'll say as a product of this residency, I'm someone else who came in without much in the way of research experience or background. And I left here with a lot of those skills, and also with probably one of the most impressive CVs on my own personal interview trail. So the system works. I'm going to talk about education. And if you just to briefly revisit the program aim, it's right in here that this is part of our mission, is educational mastery. And what I'm going to talk about isn't so much what we teach or how we teach, but it's more the product, the end product of a educator as a product of our program, and the culture of education that's part of our program. So education is extremely important to us. It's what we do. It permeates everything that we do, all parts of our mission. It's a lot of the reason that those of us who are practicing here practice here. The residents are core to everything that we do. So the clinical care, the research, all of that is education as well, and all of it is developing residents. But there's also the direct teaching of medicine and surgery to the residents, and from residents to other residents, and to students from us and other residents. So and patients, of course. It's education in all direction. We think it is important that residents are educators. We want residents who are here who want to teach and be educators. We want to help you be that person. We want to model it. We want to support you, and we want to develop you into that. So how do we prove that we succeed at doing that? The best outcome I know of, the coin of the realm, if you will, in teaching and education, is teaching awards. So the best objective way I know how to tell you that we do this well and that the system works and that we have a long history is look at how we do in terms of our observed to expected ratio for teaching awards. So in terms of who we are, we have 5 categorical residents per year on average. There are about 800 house staff, a little more at UVA. So we're between 4 and 5% of the UVA house staff. So how do we do in terms of our residents winning teaching awards? We got to look at it. We got to have a name for the thing we're doing. And I propose that we are the best ever at surgical teaching. And I think we are such a thing all the time. It's not just 1 year or 1 resident. So that's the mode. So this is the beast mode quotient, the observed to expected ratio. So some of the awards. This award is given to a single member of the house staff across the whole institution, felt by the graduating class to have displayed the greatest enthusiasm for teaching students while inspiring them through common experience of uncertainty assuaged by ideas. These are some of our people who have won this award, again, a single resident per year. So therefore, we are 16 times overrepresented for our numbers as surgery residents over the last 10 years and about 15 times over the last 20 years. So that's a pretty solid record. You can see 1 year here, 2 awards were given. That's the only year to have been given. They were both to general surgery residents. The Mulholland Teaching Award, also nominated by students, 3rd and 4th year students, recognizing excellence in medical student teaching, both formal and informal, as basically in the 3rd and 4th clinical year. This is given to between 6 and 10 residents per year. And every year for the last 10 years at least, we've had at least 2 general surgery residents. Here are the names of some of these folks, several of whom are still within our program. The 5-year disproportionate representation is 5%, and the 10-year, the 5.5 O to E ratio, the beast mode quotient. The Gold Humanism and Excellence Award. So you guys are probably mostly familiar with the Gold Humanism Society. So this is a teaching award, but it also recognizes compassion in treatment of patients, families, students, and colleagues. So that that wonderful combination that we love to foster. Amy Coey has won this award twice, I believe, and multiple others. The 1 year, 4 of the 5 people awarded this award, 4 were general surgery residents. So for that individual year, it was a quotient of 21, and overall, it's a quotient of 8.4. So again, doing very well. This award is really more so recognizing compassionate clinicians, and only 1 year where surgeons, even as recently the criteria have been changed, surgeons weren't eligible. And in that 1 year that we've been eligible, we had a general surgery resident win that award. So did very well. That was a beast mode quotient of 7. This award is a national award. So from the Association of Women Surgeons, single resident per year nationally, 3 of our residents, including one who's now on our faculty, Tracy Hedrick, have won this award. So over the lifetime of the award, national O to E ratio of 21, which is really pretty impressive. We've had other national award recipients and finalists as noted here. So our residents have really done extremely well. And the way we achieve that, of course, is attracting people who are interested in this, having it permeate every single thing that we do from our residents and from our faculty. We model it, we teach it, we foster it, and these are a list of some of the awards as faculty that we've won at various different levels. And for most of these, it's multiple members of our faculty who have won these teaching awards. So basically every local teaching award and many national recognitions as well. But the reality, of course, isn't the faculty, it's the people we bring in. It's a self-perpetuating environment where education really is a very important part of who we are and what we do. This is our entry and intern class of categorical and prelim residents that's currently with us this year. And it's really all about you guys, and that's how we keep making this be this successful environment that I've seen since I was a 3rd-year medical student here, close to the turn of the century. So for at least that time, it's been all about who we are. So it's a great environment to be a part of. Now I'll turn it back over to Charlie.
So I think Dr. Showalter and Dr. Smith really spoke to, one of the tenets of our residency is that the residents are integral to everything that we do. We cannot be successful without successful residents. That's in the clinical realm where we're providing clinical care. That is in the education realm where you're working with medical students, but also with each other. And clearly that is in the research realm where our success is your success and vice versa. We just will not succeed unless we attract, people who have a commitment and a passion and who want to be, really academic surgeons. And if that is something that feels right to you, then by all means you should apply, and we should discuss this further. But that is, the type of person we're trying to attract. So if you have any questions for Dr. Showalter or Dr. Smith or myself, feel free to raise your hand at this point, and we'll monitor this for a bit. And if not, we'll probably pretty soon excuse ourselves and allow you to get to the breakout rooms where you can once again kind of discuss all these issues with our residents, and you can confirm if we're telling you the truth or not. I'm not seeing any hands being raised. Kristen, is that right? Can you confirm that with a nod?
Melanie Fritz has her hand up. I don't know if she has her virtual hand up or not.
I'm relying on Kristen to help me out here.
Great, thank you so much. Can you
there
hear
we
me
go.
okay?
Yes.
Yep, we can hear
Fabulous.
you. Great.
Thank you so
Welcome.
much. I'm Melanie. I'm from Boston University. I had a question about research, and I missed the first couple of minutes, so apologies if this was mentioned. I'm really interested in qualitative research, especially around shared decision-making and palliative care and ethics of patient communication. So I was curious if there are those sorts of supports you mentioned, Dr. Showalter, for like qualitative research as well.
Yeah, that's a great question. So the answer to that is yes. And like right now off the top of my head, I could not tell you who exactly I would send you to if you wanted to have that conversation. But what I could say is that there's enough people in our department and that we could get you to the right place and to the right people. There's some amazing palliative care clinicians and researchers within the cancer center that I've worked with on a clinical level. But just hearing that, it starts like my wheels turning, and I would, if you and I were sitting in my office, could quickly talk to people, reach out, talk to colleagues, and figure out a plan and a way to help you get involved. And what we've done oftentimes in that situation is kind of gotten people hooked up early on in their residency, just so that they can meet these folks, work with them, so that when you're making the decision of where to actually spend your dedicated years, that we can make sure that you're making a good fit, and either you do stuff on the side if it's not within our department, or we really formulate a time for you with a mentor, a primary mentor that's not necessarily within the Department of Surgery.
But I think Dr. Showalter's point is a really good one. First of all, yes, we have some labs and whatnot that are fairly greased that people might go into, but we also have residents that come up with other ideas, and we're here to support that. If you have a passion and commitment and a will, we can usually point you in the right direction, even if it's something that no one else has done before. I would say the most successful residents have multiple projects going on as well. So you might be working with Dr. Showalter on breast cancer in the funded component, but maybe you have a palliative angle and you work with somebody else, and you're working on multiple projects, and that's how you end up with nearly 300 publications between 5 residents. Where that means about 60 each, because they're not just working on one realm; they're working in multiple areas. So I think we're getting to the time we probably should go to the breakout rooms. We've got several residents waiting there to chat with you guys. And so we're going to say goodnight, and Dr. Showalter and Dr. Smith and I will fade away and allow you the opportunity to really discuss this in some depth with our general surgery residents. So thank you again, and I hope you like what you heard. Once again, if you want to review the session from last week, please go to our website, and you can listen to about our operative experience of listening to Charlottesville.
And if you're continuing to be interested, please join us next week when we're going to talk about diversity, inclusion, and the general culture of our program. So thank you again, and good night.